Welcome to the Stanford 25 Direct Ophthalmoscopy for the internist. The objectives for this video will be twofold. The first is essentially a review of the various settings on any given direct ophthalmoscope, and the second is a step-by-step approach to using the ophthalmoscope. The lessons from this video can be used for any traditional direct ophthalmoscope as pictured here, or for a panoptic direct ophthalmoscope, which is essentially the same thing with a few added benefits, including a larger view of the retina. Of note, the ophthalmoscope used in the rest of this video is the panoptic. As you probably know, most ophthalmoscopes have various brightness settings. The purpose of the brightness variability allows you to minimize as much as possible the brightness of your ophthalmoscope in an effort to minimize pupil constriction. You may have noticed varying sizes of large white beams in most ophthalmoscopes. The reasons for the varying sizes are essentially to accommodate the various sizes of pupil dilation. In the largest size circle here, you would use this typically in a dilated eye. The red free light, which shows up as green, is classically used for having better visualization of the vessels of the retina. The red-free setting is particularly useful when looking for nicking in patients with hypertension or new vessel growth in patients with diabetes. Next, the half beam is a setting which can be used for patients with early lens opacification. It essentially allows light to enter through the lens in an area where there is no opacification to help minimize blurriness. Finally, the slit beam is used to examine the cornea and anterior chamber of the eye. Additionally, it can be used to examine the contours of structures or abnormalities of the cornea, lens, and retina. To be complete, some other settings often found include a grid to look for relative distances in the retina, and blue light with the addition of fluorescein can look for corneal abrasions. Shown here is the panoptic ophthalmoscope. As you can see, in the front there's a wheel controlling the lens size. And you essentially have two options. You can either make the wheel more red or make it more green. And there's really only a couple of things you need to know. If you're farsighted, meaning you have difficulty seeing up close, then what you want to do is turn the wheel towards green. Sometimes this is denoted as a positive sign on older ophthalmoscopes, and sometimes it's even noted in black. Alternatively, if you're nearsighted, meaning you have difficulty seeing far away, you want to make the wheel go more towards the red side, or minus, to help bring your focus into view. Another way of thinking of this is, if you make the dial more green, you'll be able to focus in on things close, and if you make the dial more red, you'll be able to focus better on things far away. Now that we have all the settings down on our ophthalmoscope, it's time to do one last thing, which is use it. Before we begin the demonstration, there's a few things to do first. With the panoptic, you'll want to look through the lens at an object approximately 15 feet away to ensure that you're in focus. Again, as mentioned earlier, if you have difficulty seeing far away or nearsighted, you'll want to turn the wheel towards the red. Next, have the patient focus on an object as far away as possible to help dilate the pupil. Third, you'll darken the room again to dilate the pupil. Next, you'll want to turn on your ophthalmoscope to a power level of approximately 80 to 90%. In doing so, you may be able to minimize the amount of pupil constriction when turning on the light. Now we're ready to look into the eye. The first and most important step is looking for the red reflex. To do this, hold your ophthalmoscope approximately 2 feet away from the patient's eye at an angle about 15 degrees from center. This will position you in the direction of the patient's blind spot in line with their optic disc, and also will help prevent pupil constriction. Here is a good example of the red reflex. Once you have this, simply follow it all the way into the eye until you see the vessels and optic disc. As you get closer, the patient may become more irritated and may blink more often. If you lose the red reflex, simply come back, as you see here in this video, and go back in again, and continue doing this until you get a nice view of the retina. At this point we see the optic disc, and once we have it in view we'll freeze it. You'll note the pale center of the optic disc, which is referred to as the optic cup, which is generally about 1/3 the diameter of the disc. One last note before we conclude. When using a traditional direct ophthalmoscope, you'll pivot around the center in an effort to look throughout the retina. However, when using the panoptic, you'll ask the patient to look up to look at the upper part of the retina, down to look at the lower part of the retina, medially to look medially, and laterally to look laterally. Finally, you can also ask them to look towards the light in an effort to see the macula. So this concludes our video on direct ophthalmoscopy for the internist. Hope you found it useful and wish you best of luck in practicing.